Now, I want to look at the pathogenesis of pelvic inflammatory disease. Okay, that's a PID. So, in pelvic inflammatory disease, of course, there's inflammation of the uterus. If you go up to the fallopian tubes, there's inflammation. If you go up to the ovaries, there's also what? There's also inflammation of the ovaries. Okay. So what we have is usually developed from infections most of the times, okay? And these infections mostly they don't start within the uterus. They start in the vagina. They can even start from the vulva, go into the vagina, go up to the cervix, go up to the uterus, go up to the fallopian tubes, go up to the ovaries. Do you understand? So it's the infections that usually cause the inflammation, tissues die off, cause the scarrings and all of that. So, initiation of a microbial infection. So, primary pathogens like Neisseria, gonorrhoeae, Chlamydia, trachomatis, Mycoplasma, genitalium are all the microorganisms that usually cause the infections. So, secondary organisms like anaerobes, facultative bacteria, bacterial vaginosis. So, the infection is usually ascending. Okay. So, like I told you, begins in the vagina or cervix, goes up. So factors that facilitate the ascent is menstruation, sexual activity. Sometimes you are having sex, you are pushing infections further in. Then instrumentation, that's like due to some medical stuff. So inflammatory response, so the body responds with neutrophils and macrophage. Will now cause edema, tissue starts swelling up, that's hyperemia, the tubes will start damaging up. There's now accumulation of pores and all of that. That's what we call pyrosalpinx. That's accumulation of pores in the fallopian tube. So next we have tissue damage and sequelae. So persistent inflammation will cause fibrosis and adhesions, tubal occlusion, chronic pain will set in. Then your body will now respond. Okay. Of course, the response is different based on what your body is made up of. Okay. So what will actually make it very easy for you to have pelvic inflammatory disease is if you have multiple sexual partners, okay, or you started having sex early, okay, dosing or increased risk. So that's what we have for the pathogenesis of the pelvic inflammatory disease.